Revalidation of Puerto Rico, clinical questions on the parasympathetic nervous system. 1. A 67-year-old man with a history of Parkinson's disease presents with difficulty urinating. He has been taking benztropine for his symptoms. Which of the following mechanisms best explains his urinary retention? A. A1 adrenergic receptor activation. B. M3 muscarinic receptor blockade. C. Beta2 adrenergic receptor stimulation. D. Nicotinic receptor activation. Answer B. M3 muscarinic receptor blockade. Explanation: benztropine is an anticholinergic drug that blocks M3 receptors in the detrusor muscle, leading to urinary retention. 2. A patient with myasthenia gravis is prescribed pyridostigmine. What is the mechanism of action of this drug? A. A1 receptor agonist. B. Acetylcholinesterase inhibitor. C. NMDA receptor blocker. D. Beta1 receptor agonist. Answer B. Acetylcholinesterase inhibitor. Explanation: pyridostigmine is a reversible acetylcholinesterase inhibitor, increasing acetylcholine availability at the neuromuscular junction to improve muscle strength. 3. Which of the following physiological effects is mediated by the parasympathetic nervous system? A. Bronchodilation. B. Decreased gastrointestinal motility. C. Pupil constriction. D. Increased heart rate. Answer C. Pupil constriction. Explanation: the parasympathetic system 3 receptors causes meiosis, pupil constriction, via contraction of the sphincter pupillae muscle. 4. A patient presents with bradycardia, excessive salivation, and diarrhea after accidental ingestion of insecticide. Which of the following is the best initial treatment? A. Atropine. B. Epinephrine. C. Naloxone. D. Flumazenil. Answer A. Explanation: the patient is experiencing organophosphate poisoning, cholinergic crisis, which leads to excessive parasympathetic activity. Atropine is a muscarinic receptor antagonist that counteracts these effects. 5. Which cranial nerves carry parasympathetic fibers? A. CN2 3 6 ein. B. CN3 7 einx x. C. CNV 7 einx x. D. CN4 sec x. Answer B. CN3 7 x. Explanation: the parasympathetic cranial nerves are CN3 oculomotor, pupil constriction, CN7 facial, lacrimation, salivation, CN9 glossopharyngeal, parotid gland secretion, CNX vagus, heart, lungs, GI tract. Hack 6. A 35-year-old woman is given atropine before surgery. Which of the following effects is expected? A. Increased salivation. B. Decreased heart rate. C. Urinary urgency. D. Dry mouth. Answer D. Explanation: atropine is an anticholinergic drug that blocks muscarinic receptors, leading to decreased salivation, dry mouth, increased heart rate, and urinary retention. 7. Which neurotransmitter is released by the parasympathetic preganglionic and postganglionic neurons? A. Norepinephrine. B. Dopamine. C. Acetylcholine. D. Epinephrine. Answer C. Explanation: the parasympathetic nervous system releases acetylcholine, ACH, at both preganglionic and postganglionic synapses. 8. Which of the following drugs is a direct muscarinic agonist? A. Atropine. B. Bethanechol. C. Epinephrine. D. Phenylephrine. Answer B. Bethanechol. Explanation: bethanechol is a muscarinic receptor agonist that stimulates bladder contraction and gastric motility, used for urinary retention and postoperative ileus. 9. A 70-year-old patient with Alzheimer's disease is prescribed donepezil. What is its primary mechanism of action? A. Inhibits norepinephrine reuptake. B. Blocks dopamine receptors. C. Inhibits acetylcholinesterase. D. Antagonizes NMDA receptors. Answer C. Inhibits acetylcholinesterase. Explanation: donepezil is an acetylcholinesterase inhibitor, increasing acetylcholine levels in the brain to improve cognitive function in Alzheimer's disease. 10. A patient receives a cholinergic agonist for a medical condition. Which of the following side effects is most likely? A. Dry skin. B. Mydriasis, pupil dilation. C. Diarrhea. D. Urinary retention. Answer C. Diarrhea. Explanation: cholinergic agonists stimulate the parasympathetic system, leading to increased GI motility and diarrhea. Key takeaways for medical revalidation of Puerto Rico: parasympathetic rest and digest. ACH is the main neurotransmitter. Muscarinic receptors M1, M5 mediate effects. Anticholinergic drugs, e.g. atropine, block parasympathetic effects. Cholinergic crisis, organophosphate poisoning, treated with atropine plus pralidoxime. Would you like more detailed explanations on